Have you ever jolted awake in the middle of the night because you suddenly had to pee? Many men think getting up several times a night is just part of getting older. In reality, frequent nighttime urination can be a warning flag that something more serious is going on. One of the biggest concerns is prostate cancer, a very common disease in men your age. It is scary to think about, but here is the hopeful part. When prostate cancer is found, early treatment is often very effective. The key is not to miss the early signs. In this video, I will walk you through 10 subtle warning signs of prostate cancer that many men overlook. If you notice any of these in yourself, do not ignore them. Talk to your doctor and get checked to protect your health. So, what is the first sign? It is a change that many men brush off as normal aging, but it may be your body quietly asking for help. Let us take a closer look. Sign 1: burning or painful urination. Have you ever felt a sharp sting or burning sensation when you pee? Many people brush this off as a small problem or just another part of getting older, but in reality, this can be one of the earliest warning signs that something is wrong with the prostate. When the prostate grows larger than normal, it can squeeze the urethra and interfere with the normal flow of urine. This doesn't just cause discomfort or burning, it can also increase the risk of urinary tract infections, and if ignored, lead to more serious complications. That's why any pain while urinating, especially if it continues for more than 3 days, should never be taken lightly. Don't wait and hope it goes away on its own. Getting examined early can help you find the cause and deal with the problem before it develops into something more dangerous. Sign 2: frequent trips to the bathroom at night. Have you ever been fast asleep only to suddenly wake up because you urgently need to pee? It drains your energy, right? Your sleep is broken, you toss and turn, and by morning, you feel as if you barely rested at all. Waking up once in a while is one thing, but getting up over and over again at night to urinate can be a sign of something more serious than just drinking a bit too much water before bed. Many people simply chalk it up to getting older or having a cup of tea in the evening, but you should know this is actually one of the early warning signs you must not overlook. A lot of men mistakenly blame it on late-night drinks or natural aging. In reality, getting up once or even twice a night can still be considered normal for people over 60. But if you are waking 3 times or more every night and this pattern goes on for a long period, that may be an abnormal signal coming from your prostate, and it deserves more attention. So, if you notice that you are stumbling out of bed too many times each night and waking up exhausted the next day, it could be a sign of a prostate problem. And I want to stress that these symptoms are not something to ignore. Early detection is one of the most powerful ways to protect your health. A simple checkup with your doctor can give you clearer answers and much greater peace of mind. So, what other hidden signs might be warning you about prostate cancer without you realizing it? Yet keep following along, because recognizing these signals in time could quite literally save your life. Sign 3: blood appearing in your urine. Seeing blood in your urine can be frightening, yet many people try to reassure themselves that it is just a small issue or a passing infection. The truth is, even a single episode of blood in the urine can be a serious warning sign of prostate cancer. When cancer develops in the prostate, the growing tumor may press on surrounding structures such as the bladder and urethra. This pressure can cause bleeding, which may show up as microscopic hematuria that only tests can detect, or as visible blood that clearly changes the color of your urine. If this happens to you, do not try to guess the cause or wait for it to fade on its own. You should see a doctor as soon as possible. A symptom like this is a chance to detect the prostate cancer in its early stages, and that can be life-saving. And remember, you should not wait until the signs become dramatic or obvious. There are many other more subtle changes that can quietly point toward a prostate problem. So, let us move on to the next important signals you may have been overlooking, because catching these signs early is one of the most powerful ways to protect your long-term health. Sign 4: lower back, hip, or leg pain. Aches in your lower back, hips, or legs are easy to blame on everyday life. Maybe you think it is from sitting too long, lifting something heavy, or simply the wear and tear of getting older. But when this pain lingers, keeps coming back, or has no clear cause, it may be more than just a muscle strain. It can be one of the hidden warning signs of prostate cancer. As prostate cancer develops, it can spread to nearby bones, and the spine is often one of the first places affected. This can create a deep, dull, nagging pain that makes walking standing up or even turning over in bed uncomfortable. What is especially important is when the pain does not improve with rest stretching or common painkillers. That is a signal your body may be trying to tell you something serious. So, how can you tell if this is just ordinary back pain or something more? It is actually quite simple if you notice persistent, unexplained pain that refuses to go away. No matter what you try, it is time to stop ignoring it and see a doctor. Many men never imagine that back or hip pain could be connected to their prostate, but prostate cancer can spread to these areas and cause stubborn pain that should not be brushed aside. If you are dealing with pain that lasts without a clear reason, do not postpone a medical checkup. Finding prostate cancer early gives you a much better chance of successful treatment and helps you avoid serious complications later on. And remember, a symptom you have always considered harmless could actually be a clear warning sign. The next sign might completely change the way you look at what your body has been trying to tell you. Sign 5, unexplained weight loss. If the number on the scale suddenly starts dropping, and you have not changed the way you eat or move, it is easy to shrug it off. You might even feel a bit pleased thinking you are finally losing some belly fat. But when your body loses weight for no clear reason, it is not just a cosmetic change, it can be a serious warning signal. As prostate cancer develops, cancer cells can start consuming a lot of your body's energy and disrupt your normal metabolism. This energy drain may lead to unplanned weight loss. Along with that, you might feel unusually tired, lose your appetite, or even feel nauseous. That is why unexplained weight loss should never be seen as normal or harmless. You may think dropping a few kilos is nothing to worry about. But if you lose more than 5% of your body weight within 6 months without any obvious cause, your body may be trying to tell you that something is wrong. Do not overlook this change. If you notice yourself slimming down suddenly without changing your diet or exercise routine, make an appointment with your doctor as soon as possible. This could be one of the early clues pointing to prostate cancer, and catching it early makes treatment more effective. And there is more. Another subtle sign can show up quietly, whether you are relaxing at home or out running errands. Keep going to discover the next warning sign, so you do not miss what your body is trying to say. Sign 6. Pain or discomfort in the rectal area. You might sometimes feel an ache or pressure deep in your lower abdomen, or a sensation like something is pressing on your rectum, and assume it is just gas constipation or another simple digestive issue. But when this kind of discomfort lingers or has no clear cause, it may be a sign you should not ignore, because it can be linked to prostate cancer. As prostate cancer grows, it can extend toward the rectal area and trigger symptoms such as pain, a feeling of fullness or bloating, ongoing constipation, or even trouble passing urine. Because these complaints sound very similar to common digestive problems, they are often dismissed or misinterpreted. The danger is when they keep coming back or never fully go away. Persistent rectal pressure, abdominal discomfort, or changes in bowel habits can be your body's way of warning you that something more serious is happening behind the scenes. That is why relying on your own guesses or assuming it is just digestion can be risky. If you notice abdominal pain, bloating, or rectal discomfort that lasts more than 2 weeks, do not brush it off as ordinary indigestion. Make an appointment with your doctor and get evaluated as soon as possible. Detecting prostate cancer early can greatly reduce the risk of severe complications later on. And yes, other warning signs can also look like everyday problems at first glance. Keep going to discover the next sign you may never have connected to prostate cancer before. Sign 7. Pain when sitting for a long time. It is normal to feel a bit stiff after sitting too long, especially on hard seats like stone benches or plastic chairs. But if after a period of sitting, you begin to notice real pain, numbness, or a heavy pressing sensation deep in your pelvic area, that is not something you should casually dismiss. When the prostate becomes enlarged or turns cancerous, it can press on nearby structures in the pelvis. This added pressure can lead to pain, discomfort, or a strange full feeling whenever you sit for an extended time. As the tumor grows, this discomfort may gradually worsen, making long periods of sitting increasingly unbearable. You might chuckle and tell yourself it is just ordinary soreness from sitting too long. But if the pain keeps returning or never truly goes away, you could be overlooking an important warning sign. Pay close attention to what your body is telling you. Ongoing pain or numbness in the pelvic or perineal area while sitting is not normal. If you regularly feel this kind of persistent discomfort, especially focused between the genitals and the anus, it may be linked to a prostate problem, including prostate cancer. Do not be afraid or embarrassed to talk to your doctor and request an early evaluation. So, what other signals might be easy to confuse with everyday issues? Without realizing it, you may have missed them. Stay with me in the next section to discover more key symptoms that could quietly be affecting your health. Sign 8: difficulty starting or maintaining a urine stream. You go to the bathroom, stand there and wait, but the urine just will not come. Or when it finally does, the stream is weak stops and starts but only drips out slowly. This is a classic sign that urine flow is being blocked. When the prostate becomes enlarged or cancerous, it can squeeze the urethra and narrow the passage for urine. That does not only make it hard to begin urinating, it also causes a weak, interrupted stream that can leave you feeling frustrated and uncomfortable every time you use the toilet. This is not just an inconvenience, it is one of the early warning signs of prostate cancer that you should never overlook. Difficulty getting urine started is a symptom many men get used to and simply live with, but you should not let it become your new normal. If this problem keeps happening, treat it as a serious message from your body and get it checked as soon as possible. You definitely do not want these symptoms to slowly take over your daily life. Do not ignore trouble urinating or a weak urine stream and hope it will fix itself. Talk to your doctor and have a full evaluation. Finding the cause early can help you avoid many complications and protect your long-term health. And there are still other warning signs that might not look dramatic but are extremely important. You could be missing them without realizing it. Stay with me, because the next symptoms we talk about may play a big role in your future health. Sign 9: loss of bladder control, incontinence. Have you ever noticed urine leaking out when you sneeze, laugh, cough, or simply do not make it to the toilet in time? If this happens repeatedly, do not rush to blame it on just getting older. Incontinence can be an important warning sign that something more serious is going on. As prostate cancer advances, or after treatments such as radiation therapy or prostatectomy, the nerves and muscles that control the bladder can be damaged. This may lead to urine leakage, difficulty holding urine, or even a complete loss of bladder control. It is crucial not to treat this as a minor, temporary annoyance and ignore it. If you realize that incontinence keeps occurring or begins to interfere with your daily activities and confidence, you should speak to your doctor. It might be related to prostate cancer itself or a side effect of its treatment. Early evaluation and screening can help you understand the cause, manage the problem, and find the right options to improve your quality of life. Do not let this condition make you feel embarrassed or less confident. You are not alone and help is available. But this is not the only sign you need to watch for. Some symptoms can appear in places you would never expect. Keep going to discover the next sign and understand more about what your body may be trying to tell you. Sign 10: painful ejaculation. Intimacy is a natural and important part of life. But if you begin to feel a sharp sting, a dull ache, or a burning sensation after ejaculation, that is a signal you must not overlook. It is not only uncomfortable, it can also be a warning sign of prostate cancer. As a tumor grows in the prostate, it can affect nearby structures such as the ejaculatory ducts and seminal vesicles, leading to pain after ejaculation. This discomfort may feel like a sharp pain in the penis, a deep ache in the testicles, or a burning sensation in the lower abdomen. If you notice this kind of pain when you ejaculate, do not brush it off. Even if it happens only once, it may mean something is not right with your prostate, especially if the pain comes back or gradually becomes more frequent. Many men assume painful ejaculation is just a minor, temporary issue. In reality, it can be a sign of a serious underlying problem, and early screening can help detect prostate cancer at an earlier stage when treatment works best. So, now we have gone through 10 warning signs of prostate cancer that deserve your attention. These symptoms can be subtle and easy to dismiss, but recognizing them early can completely change the course of your health and even your life. As you have seen, prostate cancer can quietly develop in the body without obvious signs at the beginning. That is why early detection is so important to avoid dangerous consequences. By paying close attention to changes in your body and scheduling regular checkups, you can take an active role in protecting your prostate health and your future. Prostate cancer starts when prostate cells suddenly go out of control. They multiply non-stop and stop dying when they should. Over time, these abnormal cells can form a tumor. If that tumor is not found and treated, it can break through the natural boundaries of the prostate and spread to nearby areas. This process is called metastasis. The pelvis, spine, bladder, and rectum are some of the most common places it can invade. The truly dangerous part is that in the early stages, prostate cancer often causes no obvious signs at all. That is why regular screening is so important. It is the only way to reliably detect the disease early. Prostate cancer develops quietly as those cells keep multiplying and forming a tumor. Left unchecked, that tumor can spread to distant parts of the body and lead to serious, even life-threatening complications. The encouraging news is that early detection can change everything and may quite literally save your life. The most effective way to catch it early is to have routine prostate screenings. If you are over 50, make sure prostate checkups are part of your regular health routine. Certain factors such as getting older, having a family history of prostate cancer, being overweight, or belonging to higher risk racial groups can all increase your chances. But with early detection and a sensible prevention plan, you can take control instead of being caught off guard. Do not let indifference or ignoring small warning signs become a costly mistake. Take action now for your own health and for the people who care about you. Subscribe to the channel so you do not miss future videos on health protection and disease prevention. Share this video so more people in your family and community can understand the risks of prostate cancer and stay alert. And let us know your thoughts in the comments. If you have gone for a prostate checkup or are planning one, sharing your experience might give someone else the courage to do the same. Sometimes one timely video and one timely decision can be the key to saving your life or the life of someone you love. Together, let us spread this awareness because your health is your most precious asset. Thank you for watching, and we will see you in the next video.